Increased testing is key as communities move toward the new normal. A community's ability to test more people has been a key metric in the state's reopening phases. Lancaster General Health's Chief of Infectious Diseases talked to WGAL News 8's Susan Shapiro about how increased testing will work.
I think the best case scenario that we can hope for with COVID-19 is that it basically calms down and becomes a seasonal outbreak just like the flu. So when we get to wintertime, there are already 4 coronaviruses that we see every winter. This may be the 5th one that we see with some regularity. Clearly, our testing coming this fall will have to include COVID-19 testing in addition to influenza and the other viruses that we test for. And I think that'll be almost a permanent feature of laboratory testing.
And is it likely to be even more confusing as we go back into a new flu season?
Well, clinically, it's very difficult to distinguish COVID-19 infection from influenza or from a number of other respiratory viruses that we see every year. Even at this point, only about 15% of the people who are sick with coughs and fevers actually have COVID-19. The rest have something else. So there are other viruses out there, and that will always be the case. So without good and accurate testing, it's going to be very difficult to distinguish who's got COVID-19 and who's got influenza.
I imagine this is going to have a long-lasting impact on the healthcare industry for many months, if not years to come.
Absolutely. Healthcare systems have been preparing for pandemics for a long time. I don't think any of us anticipated the degree and the extensive spread of this particular virus, but that's something we will have to be ready for in the future. Hospitals will have to ramp up storage of personal protective equipment, of ventilators. Hospitals may need to expand their bed capacity to have empty beds that are in reserve in case of pandemics. All of those things are at this point not something that's common in hospital systems, but will have to be going forward.
Susan also shows us what to expect when you go to your next dentist appointment. That too will be a different experience.
It hasn't gotten any better.
Dentists have always practiced infection control, but now they're doing more to keep patients safe amid COVID-19.
It's just really feeling a responsibility to keep everyone safe.
Patients at O'Donnell and Phillips get a temperature check and answer screening questions upon arrival. Appointment times are staggered to avoid interaction with others.
I don't mind because I think it's better safety-wise that they check it and they know, and you're just more secure.
We have a face shield that we use. We also have a KN95 mask here that we place on, and then we put the level 3 mask over top of that.
The dentist will wear additional PPE when doing procedures that create aerosol.
It just takes a little bit of getting used to, but we've always worn eye protection in the past, and wearing a couple different levels is not the end of the world.
Ann Reichenbach was here for a permanent crown. Although in pain, she wasn't worried.
I feel safer in here than I do at the grocery store.
The dentists and staff don't wear their lab coats or scrubs home. They leave them here, and they all get laundered right on site.
The practice is removing carpet and making other changes that are easier to clean. And there's no spitting. The old cuspidor is a thing of the past. Susan Shapiro, WGAL News 8.
Coming up, how the Nittany Lions are preparing for fall football and the possibility of playing in an empty Beaver Stadium.